So I got you guys good yesterday, didn't I? You guys thought we already had those 100 likes, but no, we didn't. We still have 15 likes to go, so there was no change from yesterday. We still have 15. We have 85 likes to the prepare for the CCHI video. That's why I made you this little sign. I want you to please like 100 times. Hopefully that'll get us all motivated, right? That'll get us back in the game. Let's go. Let's get those measly 15 likes that we are still missing, right? We want to get the MIP 21 to YouTube. So come on, guys, we're almost there. Like, we just stopped. Like, we're 4 feet from what's that saying? 4 feet from wealth, 4 feet away from success. I don't know. I don't remember the saying, but it goes a little bit like that. And yes, Fabiola, it doesn't matter if those likes come from Mexico. As a matter of fact, I am in Mexico, so we do not discriminate here. Anyone, well, a whole world's welcome. That's why it's interpret your world, right? The whole world is welcome. We don't discriminate here, and we wish the whole world that all of our likes would come from the whole world. Hopefully one day that will be true. All right, so yeah, guys, I want you to please like 100 times. We're still trying to get the prepare the CCHI to 100 likes. That way we can post MIP 21 to YouTube. Once we get that video to 100 likes, we're gonna be giving you guys a chance to comment on that video, and we're gonna pick 2 comments at random. The people who made those 2 comments are gonna get exclusive links to MIP 22. That way they can record their interpretations, send them over to us, and then we will give them some feedback. Doesn't that sound awesome? Of course it sounds awesome. And what are we requesting in return? Exactly. Oh, sorry. There we go. I want you to please like 100 times. So let's do it, guys. I'm pretty sure we can do it. I'm pretty sure we can do it by this Wednesday. Can we do it by this Wednesday? Yes, we can. So hello and welcome to Unwind Sessions, where right after my shift I give the highlights of my workday and answer any questions that might have been asked at a previous session. My name is Juan. I am an English, Spanish, medical, video, remote, consecutive interpreter with over 4 years of experience. Today is Friday, August 20th, thank God, 2021. And yeah, I slept late last night. I just couldn't fall asleep, so I just stayed up playing video games, right? Who does that? I know a lot of people do. So I feel their pain today, and I'm glad it's over. I still got a lot of homework on the weekend, so that's not what you're here for, right? Well, I took 30 sessions today. It was a mix audio video sessions. There was a pretty long video session, a little bit over an hour. The rest were just pretty straightforward, pretty easy. Nothing worth mentioning about interpreting. However, there is one highlight that I want to mention. Something this is more like medical interpreting, I would say, but nothing to do with interpreting. So what happened? This lady walks into the hospital saying that she forgot how to speak English. So she requested an interpreter. She said she was American. She was born in San Diego. She lived in the United States her whole life. She was bilingual, English and Spanish. And she said that 15 minutes ago, she had just been talking to her brother, and then all of a sudden, she forgot how to speak English. And that was not all. She vomited in the morning, and then what else happened to her? She had right-sided numbness, like she had numbness on the whole right side. She had a numbness of the tongue, of the lips, and the left side of her head, just like the left front side of her head, was in pain. She didn't say it was a headache because it was not the whole head. It was just like more right here, like the forward part. And she forgot how to speak English. And she could understand English completely, and she said that she was thinking in English, but the words were not coming out in English. She couldn't say them in English. She had to say them in Spanish, and I believe her because she answered everything the providers asked her. She answered it perfectly. So this was very weird. I didn't get to see the diagnosis or anything, but the providers didn't seem to be that worried about her because they left her. They were like, we'll be back in like 5 minutes and you can log off interpreter. So that was it. That was the last thing that I saw. But it was just very weird. And with all of those symptoms, I think she was having a stroke, honestly. But of course, I'm no medical doctor. I'm pretty sure that if she had been having a stroke, the doctors would have rushed on her, right? They wouldn't have just been all calm and everything like they were. But that just struck me as odd. Like, that's crazy. That's just the things that we see every day here. Well, not every day, you know. Sometimes we just see everyday stuff. But I mean, the things that we see here sometimes are just fascinating. They just leave you speechless. I wish I could have known her diagnosis and everything. I'm just that curious. But I couldn't. So, but still, I think it was worth mentioning. Like, this is something like very unusual, right? Okay, so I just wanted to mention that to you guys. And we are at that point in the video. The reason why you are here. 13 must-know mental health vocabulary terms. The definitions were obtained from vocabulary.com, mayoclinic.org. What is that? bestselfwny.org, QUIA.com, mentalhealthliteracy.org, and good old Google. Daddy Google, right? All right. So let's get started. One thing that I want to mention is that, well, not all of these. I think that out of this list, probably serotonin and bipolar disorder, those should have been in psychotherapy, and I thought I put them there. They just slipped my mind, so I'm just adding them on here. So this list should have really been 11, but I just didn't want to leave you guys without it, because there are some terms that they do come up a lot. So this is mental health because what I am I distinguish this from psychology and psychiatry, because what I'm thinking here is that a patient walks into the emergency room, and these are words that you are probably gonna hear in the emergency room, with the exception of bipolar disorder and serotonin. You might, but I never have. Alright, I just wanted to make that clear. So maybe some of these words are pretty easy, but they are still important. Alright, so let's get started. Number 1, bipolar disorder, trastorno bipolar. What is this? Bipolar disorder, formerly called maniac depression, is a mental health condition that causes extreme mood swings that include emotional highs, mania or hypomania, and lows, depression. All right, so this is a person that can yell at you, like and I have experience with a bipolar person. Of course, I'm not gonna say who, but I've had an experience with a person who has bipolar disorder. They're getting treated. They're medically treated now. But before he was even diagnosed, before this person even knew he had bipolar disorder, this was a person that all of a sudden could just get angry at you. They'll be yelling like, rah, like just dropping all of their anger on you, and then the next moment they're all smiling and making jokes, and they like the anger never happened. Like, it's just crazy. I don't, well I'm gonna stop saying crazy. It's well, yeah, it is crazy, right? But um, I don't know. I don't know what I want to say. It's not amazing. It's surprising, right? It's like very surprising. Like if you've ever experienced it, it's and especially because when I was with this when I spent time with this person was not diagnosed, so we didn't know what was going on with this person, right? So it was really, really challenging to really carry on a relationship with this person because she could be smiling, because this person could be smiling at one time and then like you just turn your back and then they're angry at you and then you turn your back and then they're just fine. So it was hard. It was hard dealing with this person. I've lived it, and I'm glad that this person was diagnosed. I'm glad that this person is under medication, and this person seems to be much, much better. Of course, I don't really get to see this person anymore, but from what I've seen from this person is doing pretty good compared to how this person used to be. So yeah, bipolar disorder means that extreme mood swings. Like one time the person can be very, very happy, and then if you turn your back, then that person could be crying, that person could be angry, and that's bipolar disorder. All right, number 2. This is withdrawal. And the Spanish translation for this is abstinencia or desintoxicación. Sorry, desintoxicación. What is this? It is a process of ceasing to take an addictive drug. I don't know if a lot of you know this or not. Honestly, this is something that I didn't know, but of course, I learned this as I became a medical interpreter, but I didn't know this before, that you can actually have withdrawal symptoms from alcoholism. And the person who is an alcoholic, they can even die. Like they can have like severe diarrhea, and they can get to the point that they can die. Like they just go cold turkey from alcohol. So in the hospitals, they administer a certain drug that helps them with alcohol withdrawal. But withdrawal can also be from any addictive substance, from heroin. I've had some cases where they've had withdrawal symptoms from heroin. What else? Well, just pretty much any addictive drug, and they get pretty bad. Some of them, everybody is different, right? But some of them, they look bad, like bad, like that you think that person like is gonna die right there, and they can even have pain. Like it's horrible. It's horrible to see someone that is experiencing like extreme cases of withdrawal, as in someone that goes to the ER because all of a sudden they want to get clean, and boom, withdrawal just kicks them in their plan, right? But it's good that it's good to have those symptoms, right? Because that means they're getting clean, but they're bad symptoms nonetheless. All right, number 3, stress. Estress. Now I know that we probably know what this is, but I really like this definition, so that's why I wanted to include it here. So stress, in current usage, this term is employed interchangeably to describe various aversive stimuli or excessive intensity, the psychological, behavioral, and subjective responses to them, the context meditating the encounter between the individual and the stressful stimuli, all of the above as a system. The term is clearly overstretched and should be used sparingly. All right, so stress is overstimulation of something, right? For example, I can stress this pen, right? If I bend this pen, it'll be stressed, and oh, you heard that click? I better not bend this pen. I better not stress this pen. I'm sorry, little pen. But yeah, I mean, everything can have stress. It's not necessarily something that the human mind or the human body is not exclusive to that, right? We have physical stress, like bending stuff, that's stress. Also, um, putting an excessive intensity on the heart, right? We could stress the heart, and there's stress tests for that. But just like if there is too much going on in our life, like we're overstimulated with information, debts, work, family, all of that stuff, problems, right? All of that stuff is overly stimulating a mind, right? Because a mind can only have so many issues on it, right? Before it starts getting like overcrammed, and then it just starts becoming overwhelming, and then stress just like, yeah, I'm here. All right, and I'm pretty sure we've all dealt with stress. It's bad, and we want to keep it away from our lives, right? So pretty easy term, but I think it's worth remembering that that is a very important term for mental health. All right, and the next one is psychotherapy, psychoterapia. Psychotherapy is a form of psychiatric treatment that involves therapeutic conversations and interactions between a therapist and a child or a family. And not necessarily a child, just a patient. Psychotherapy is just that. Going to speak with a therapist about your problems, about what's going on, in the hopes of you yourself being able to internalize and understand what is causing the issues that made you go to the therapy in the first place. All right, and number 5, substance abuse or substance dependence, and here it is. Abuso de sustancias or dependencia de sustancias. So what is this? A pretty easy term, right, as well. Now this is just the use and abuse of drugs and alcohol. Now, as we probably all know, there are people out there in the world that for some circumstance they fall into the world of drugs, maybe too much stress, too much problems, anxiety, peer pressure, their genes are predisposed, right? If you come from a family of alcoholics, there is a pretty big chance that if you drink alcohol, you can become an alcoholic. So all of those things go into play why a person would use or abuse or have a dependence for a drug. And a lot of people, well, not a lot of people, but some people do go into an ER because they're having a problem. Maybe they did a little bit too much of the substance and they're scared, so they're there to get help. All right, number 6. What is heredity? Herencia. Just like I mentioned, this is the passing on of traits from one generation to the next. So that means that this goes for everything, right? If your mom has a freckle here and you were born with a freckle here, then hey, that's hereditary. I always mess up on that word. Hereditary freckle, right? But it can be about everything. It can be mental health, it can be illnesses, it can be addictions, things that you like, taste, right? All of those things, height, all of those things are hereditary. All right, so that's just what that means. And that is one thing that I hear a lot, more like in therapy sessions where that word is used a lot. All right, number 7, support system, sistema de apoyo. All right, and what is a support system? This is a network of people in your life available to help you when you need them. Um, this support system is not really something that I hear a lot in the ER. I probably never even heard it in the ER, but I do hear it when someone, a therapist or a counselor, they go to speak to a mother who has just given birth. And they're trying to see how the mother is, right, mentally and everything. And one of the things they always ask is, do you have a support system at home? How are you, like, in case you're not able to take care of your child, do you have someone there that can help you? That way you're not overstressed and all of that. So this is very, very important, not for a ER setting, but more in a maternity department, right? When they go to evaluate the mental health of a mother who just gave birth, right? Or a mother who's about to get discharged as well. All right, number 8. This is distress, and this could be sufrimiento or peligro, and that depends a lot on context, what you will use. But distress is just extreme anxiety, sorrow, or pain. All right, so you're really gonna have to go ahead and pay attention to the context to know if it's sufrimiento or if it's peligro, right? For example, if a person is yelling and they're in pain, right? They're in distress, but not necessarily in danger, right? So that way you could use sufrimiento. But let's say, for example, and I don't know why I'm thinking of this, let's say, for example, there's a person in the middle of the ocean in a floaty, right? And then there's a whole bunch of sharks circling, and that person is going to be in peligro, right? In distress. So just make sure that you listen to context, because that is a word that has some different meanings. All right, and number 9, peer pressure, or I'm sorry, here's here, peer pressure or presión social. So what is peer pressure? This is the influence or pressure of people your age. And not necessarily of people your age, just from society, right? And peer pressure, this is like the pressure that society places upon us to do things that we otherwise might not do, right? Like, for example, when your mother tells you, hey, you gotta get out of that couch, stop watching TV, and you gotta go get a job, right? Of course, if our mother didn't tell us that, we would probably be couch potatoes, right? So some peer pressure is needed. But for example, what if there's this guy on top of a bridge and he is contemplating suicide, right? He doesn't know if he's gonna do it or not, right? He's still on that thing. But then you see some stupid people cheering him on, like, hey, jump, jump, jump. And I thought I saw this in the news sometimes, and the person did jump because he had all of this peer pressure. But it doesn't need to be that bad, right? Even in teenagers drinking alcohol, like, oh, let me tell you, show was, come on, just one beer is not gonna do anything, right? So that's peer pressure, the pressure that society puts upon us to do things that we otherwise would not do. All right, and for number 10 is a depressant, depresor. What is this? A depressant is any substance, medication, or drug that slows down a person's thinking and or physical functioning. Example includes some painkillers and alcohol, marijuana. What else could be a depressant that I can think of right off the bat? Nothing else comes to mind. But yeah, that's pretty much it. It's just these pills that slow down your functioning, right? Your thinking and physical functioning. And this is a very important word because people sometimes just go in there and they took something and they know they took something, but they don't want to tell the people in the hospital because they think they're going to call the cops and they're going to send them to jail. So sometimes the medical providers have to do a little digging, right, just to make sure they get the correct answer. And that is going to be one of the questions. Did you take any depressants? Did you take any stimulants? Which I will give you the definition for in a little bit. All right, number 11 is panic attack or ataque de pánico, right? So what is a panic attack? This is a sudden experience or of intense fear or psychological and physical discomfort that develops for no apparent reason and that includes physical symptoms such as dizziness, trembling, sweating, difficulty breathing, or increased heart rate. Occasional panic attacks are normal. If they become persistent and severe, the person can develop a panic disorder. Yeah, so a panic attack is just kind of like anxieties, I would say. But yeah, like intense fear or psychological and physical discomfort, right? That is what the definition says. So it's just an onset of fear that comes on for no apparent reason, or there could also be an apparent reason, right? For example, I bet the farm on crypto and now crypto is sinking, right? That is sure to give anyone a panic attack. Or let's say you had a car crash and the person beside you was very badly injured. That I would definitely say that is enough to give anyone a panic attack. So some people are going to go into ER setting with panic attacks or because they get panic attacks for some reason. All right, and let's go to number 12. Number 12 is stimulants or estimulantes. So these are a group of medications that improve various aspects of brain functions such as alertness and concentration. They are often used to treat ADHD. Now, yes, but they can also be drugs as well. What are well, ADHD is treated by amphetamines. Amphetamines treats ADHD, and that's a stimulant. Also, cocaine is a stimulant. What else? Methamphetamines is a stimulant. Ecstasy is a stimulant. All of those drugs that just make you like, woo, right? Give you a lot of energy or give you a lot of alertness and concentration. So stimulants. And people just go in there with stimulants that people think the medical providers might think they have a mental disorder, but they're really just high and they're just very scared of saying they're high, of course. Like they're high, right? No one wants to have a bad trip. So, I mean, if I were in their shoes, I probably wouldn't want to tell anyone I was high, but of course I'm a medical interpreter and I know that if I ever happen to take anything and I feel like that, I'll be like, well, I took 1,000 pills. All right. All right, and the number 13 is serotonin, which is serotonina, right there. All right, and what is serotonin? This is a neurotransmitter that helps in regulating many different brain functions, including mood, anxiety, and thinking. So serotonin, very important in mental health. However, this gets mentioned more in a psychological or in a psychiatric setting more than in the ER, because they usually just explain to the patient, right, that they're giving them medication to like replenish their serotonin. For example, Zoloft or sertraline is one of those medications. However, I am not sure of the process that it does. I don't know if it replenishes or it just stimulates to make more. So I'm sorry about that. But yeah, serotonin, very, very important term in medical health. All right, so that's gonna be pretty much it for me today. Please leave your questions in the comments and I will answer some of them in the next session. Remember, if anything is time sensitive, let me know. That way I can answer it before you actually need it. I'll be here every Monday through Friday after work And remember that I want you to please like 100 times to prepare for the CCHI video, guys. Don't forget that. Very, very important. And also remember that we have a Patreon page for as little as $1 of your support. You help motivate us to create much more content, and we give you access to all of the medical practice videos ad-free. We have MIP21 already on Patreon. We give you scripts to those medical videos, answer sheets, vocabulary lists, and much more content. And most importantly, you will forever win a place inside of our heart. Now, we love all of our Patreons. We love all of our subscribers. We love everyone that has bought us a coffee, and we love you that is watching the end of this video. So thank you so much for watching. Please like and subscribe if you haven't done so for much more content. And of course, don't forget to share. Happy interpreting. Goodbye.